Right now, the need for doctors in rural areas of the state is more dire than ever. WVTM 13's Aaron Llewellyn live and local in Bessemer tonight.
Aaron, a group of residency program graduates are stepping up to meet those needs.
Yeah, guys, Sherry, since 2009, the state of Alabama has lost 21% of its family medicine training positions. Now, with rural Alabama communities losing access to quality health care every day, the Cahaba Medical Center is working to change that and fill that need with its largest residency program graduation ever. It's no secret there's a need for more comprehensive health care in rural communities across the state of Alabama.
It's as rural as it gets.
Dr. Sumter Blackman worked as the town of Camden's only doctor for a long time. In the last few years, the town hired a part-time doctor, but there's still some issues to navigate.
It's just difficult to find doctors willing to come to a small area. Like Camden has one grocery store, 3 stoplights. Not many people want to get that rural.
But that doesn't bother recent medical family medicine residency graduate, Dr. Haley Warwick. She says serving patients in rural communities is her passion.
They can walk to our clinic and they can see us, and we are like the only doctor they're going to see, versus or if they go to like our rural emergency room. But we're the only ones that's doing like the primary care, the preventative care for them.
According to Cahaba Medical Care and UAB, the state of Alabama needs to fill 612 new primary care positions by 2030. After the program's graduation on Thursday night, 14 graduates will help fill some of that need, including Warwick. She'll work in Woodstock as the West Blockton Clinic's first doctor in more than a decade.
We are like those patients only like medical providers out there. It's had a big impact in my life.
And watching patients struggle with access to care made an impact on her from an early age. Warwick says her grandfather lived in rural Tennessee with diabetes, seizures, and cancer.
The local hospital was not comfortable with like dealing with like his seizures, so we would like have to like travel to Memphis like via ambulance if he was like having really bad seizures and not coming out of them.
After finishing her residency, she's looking forward to providing her patients with the care her grandfather never had.
I felt like I figured out my place in the world, and that's just to help like the underserved in the rural community.
Now this year, the program had 19 people graduate. Now 14 of them are staying right here in Alabama to help those in need get quality access to care. Live in Bessemer, Aaron Llewellyn, WVTM 13.